Hi, and welcome back to Focal Point AFR Talk. Number to call, 888-589-8840. And by the way, if you have more questions about blood moons, more questions about eschatology, they sound to me like perfect questions for exploring the Word. For Alex and Bert, they come on right after this program, load it up, and ask them questions to your heart's content. They will be able to give you far better answers than I can. Now, let's grab clip number 9. This is Bill Maher, and, you know, this Bill Maher, I'm sure he fancies himself a really, really smart guy. I think Bill Maher thinks he's just a really, really smart guy. He's way smarter than you. He's way smarter than me. He's part of the elite. He's a part of the brilliant ones, what Thomas Sowell referred to as the anointed ones that consider themselves in a class that's so far above us that they ought to have the right to run our culture and make decisions for us because we're not smart enough to figure these things out for himself. Now, I want you to listen to this soundbite, and there's something it's amazingly dense here on the part of Bill Maher. You're going to rarely see such an expression of densitude in a public figure as you're going to hear right here. This is Bill Maher talking about the prison population in the United States.
I didn't want to tell them because I don't want to brag that as far as the percentage of people thrown into prison, Russia is 8th and America is number 1.
Oh, yeah.
USA. And there's something very perverse about that because not only is that a horrifying statistic in itself, but the fact is that crime in the last 20 years is down, constantly plummeting, and yet the prison population keeps going up.
This is kind of amazing to me. He says this is perverse. It's a horrifying statistic that crime in the last 20 years is down, and yet the prison population keeps going up. Now, apparently, it has never occurred to this genius that maybe crime is down because all of the criminals are locked up. Maybe crime is down because we have the bad guys behind bars. This is apparently something that never occurred to this genius commentator. 888-589-8840, number to call. Here is clip number 9. This is Senator Sheldon Whitehouse, and he's on a Sunday morning talk show, and he's trying to come up with something good to say about Obamacare. Let's listen.
Over and over again, people still on the health care benefit from the seniors who are getting their pharmaceuticals paid for. I'm struggling for the donut hole. There we go. It's been very good for most Rhode Islanders. And
so Sheldon Whitehouse, look, I know there's something good here for seniors. I know it. If I could only think of it, if I could just think of it. Yeah, it's the donut hole. Now, Betsy McCoy has got a piece, New York Post today, called The Next Obamacare Disasters. I want to take a couple of minutes to work through some of this content, and then we'll go to the phones. Betsy McCoy used to be the lieutenant governor of the state of New York. She is probably as smart on issues of Obamacare as anybody in the country. I mean, I think Twyla Brace, who does the Healthcare Freedom Minute on this program, she's smart. She and Betsy McCoy right in the same tier as far as I'm concerned with their knowledge and awareness of the problems of Obamacare. But she's got this piece referring to the next Obamacare disasters. One other thing before I jump into this, the new head of HHS replacing Kathleen Sebelius, her name is Sylvia Burwell. She was at the Office of Management and Budget. And Mark Thiessen has a column in the Washington Post yesterday that reminded us that when she was the head of the Office of Management and Budget, OMB, her office had the responsibility to vet every single solitary speech that Barack Obama gave. That was one of their jobs. Every time Barack Obama was going to deliver a speech, that speech would go to the OMB, to Sylvia Burwell's outfit over there, and their job was to fact check that speech, to review it for accuracy, to vet it. He didn't give a single solitary speech unless Sylvia Burwell's staff of bureaucrats had signed off on it. This was since 2009. Now, the first time that Barack Obama told the lie, if you like your doctor, you can keep him. You like your insurance, you can keep him. The first time he told that lie, Sylvia Burwell was not at the OMB, but every speech he gave since then, the countless times he repeated that lie, she signed off on every single one of those assertions. And remember, the Washington Post or PolitiFact said, look, this is the lie of the year. This is the liar, liar, pants on fire, whopper of the year. If you like your insurance, you can keep it. If you like your doctor, you can keep it. And Mark Thiessen says, look, the first thing that the Senate ought to do in her confirmation hearings is ask her exactly how in the world did you sign off on that bald-faced lie 36 times? How does that happen? And how does that possibly make you qualified to take Kathleen? Well, yeah, maybe it does. I mean, maybe that puts her in the same tier of bureaucratic incompetence with Kathleen Sebelius. But here's Betsy McCoy, the next Obamacare disasters. She starts, Obamacare claimed Friday that 7.5 million people have enrolled in exchange coverage. We've discovered from the RAND Corporation that only 1.4 million of those people were previously uninsured. So remember, we started off with 46.8 million didn't have insurance. Because of Obamacare, the expense, the complete destruction of our healthcare system, that number has been reduced from 46.8 million down to, what would that be, 45.4 million. But then we've got another million that lost insurance and never got it back, at least a million. So we've gained about 400,000 people. So we're maybe at about 46.4 million people don't have insurance today. Only 400,000 net, by my calculations, have insurance that didn't have it before, and some, at least a million, had it before, and now they don't. They lost it, canceled it, never got it back. So Betsy McCoy, 7.5 million people have enrolled in exchange coverage. In fact, perhaps 20% haven't paid their first premium and therefore are not covered. So you got to knock that 7.5 million down by 20% minimum. That's 1.5. That drops it down to 6 at the total upper end. The bigger question, listen to this, is how many will keep paying premiums? This is a very, very important question. And she's one of the first ones to raise this. How many of these people that did pay their premiums are going to keep doing it? And you know who's worried about this is the American Medical Association, which is a big-time Obamacare booster. They're so worried about this that they have sent warnings out to their members. And you ask, well, why is there a concern about whether people will keep paying their premiums? Well, here's what Betsy McCoy says. First-time insurance purchasers, especially those living paycheck to paycheck, will be shocked by Obamacare's high deductibles. About $3,000 for the silver plan, which is the most commonly selected plan, and $5,000 for the bronze plan, which is the cheapest. It's not affordable, but it's the cheapest. So that's the deductible. In other words, you got the silver plan, you're paying through the nose for that. You got to spend $3,000 out of pocket before your insurance plan does you any good whatsoever. So she says, look, you'll be paying thousands out of pocket for appointments, tests, and prescriptions until you reach your deductible. Now, millennials, remember, they heard President Obama say on that silly Between the Ferns deal that they can get a health care plan for the price of a cell phone contract. But what he didn't tell you, yeah, maybe so, but your deductible is going to be $5,000. So the parallel would be, yeah, you can get a cell phone plan as long as you're willing to pay $5 a text for the first 1,000 text messages that you send. So she says, look, it's just common sense. Rather than pay thousands out of pocket for care while they're also paying premiums, they'll just quit paying premiums. They say, look, I'm paying this monthly premium, but now I've got these medical costs. I got to go to the doctor for this. I got to go to the doctor for that. I'm not covered till I get up to $5,000. I'm just starting out. It'll take me all year to get $5,000. I'm just going to quit paying my premiums. Now, here is the problem. Here is the problem for doctors. Now, we've talked about this before, but this is a serious problem for doctors. And this is why the American Medical Association is worried. Section 1412 of the health law, listen to this, gives consumers a 90-day grace period before their subsidized plan is canceled for non-payment. So you pay, and then you decide not to pay. You have a 90-day grace period. They can't cancel your policy for 90 days. But The insurance company only has to keep paying hospitals and doctors for 30 days. So you understand the problem it's creating for doctors here. The insurance company, they're off the hook after 30 days. The doctor is not off the hook for 90 days. That means when insurance can stop paying after 30 days, and that means the doctor is on his own from that point forward. So the next 60 days of care are going to be on the healthcare provider. AMA says it could pose a significant financial risk for medical practices, and that is the understatement of the year. Well, let's grab a call before the break. Let's go to Carol in Troy, Alabama. Carol, welcome. What's on your mind?
It's Carl.
Oh, Carl, go right ahead.
Yeah. I was wanting to talk about the welfare system. You had that on there a little bit earlier.
Uh-huh.
You're talking about how what could be done with the welfare system and the tax system and what's going on with that. And, you know, I've been thinking about that for a while, and it seems like the problem for me is that it's free to a lot of people. To the receivers of it, it's free. Now, if it was borrowed, if there was a lifetime maximum, if you had to pay the money back, if instead of you getting all of these benefits throughout the year and then also getting a $3,000 to $5,000 cash check at refund time, what would happen if you said, well, you got $3,500 in benefits this year, and it just so happens that now your benefits, that your tax refund is $3,500. Well, we're going to take that $3,500 in lieu of the $3,500 in food stamps that we've given you all year long, or whatever benefit. You know?
Well, you know, and they could do that, and that's, you know, Carl, not a bad suggestion really whatsoever, not a bad idea at all. But I tell you what they're doing. See, they're already starting to grab those refunds. We just saw they're grabbing refunds now for supposed debts that are 37, 40 years old, and you know, they're going to take your Obamacare penalty out of that. I don't see them taking that money to repay the federal treasury for goodies, though. Focal Point AFR Talk.